You're muted. Is that a yes?
Yes, sorry, go ahead.
Thank you. So as she said, I'm Dr. JoAnn Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges, and going to talk to you a little bit today about my journey and my path as a naturopathic physician. So before I start on, what is naturopathic medicine, I just thought I would tell you a little bit about myself. So let's see. I wanted to be a doctor. Actually, I wanted to be a singing doctor when I was 2. And from there, figured, okay, I think the doctor part's a little bit more stable than the singing part. So I very much pursued that. Throughout high school, I thought I was going to be a psychiatrist. So I volunteered on suicide hotlines as a teenager. I'm dating myself here, a candy striper in a hospital. And yes, they had those, and we had the outfits too. And from there, I chose an undergrad program that had a really solid pre-med track and was really excited for that. At the end of my freshman year of college, arranged for a psych research project for myself at the local psychiatric hospital. And the very first day on the floor, realized that, wow, this was just not what I thought it was going to be, and it wasn't for me. And so I started on this journey of trying to figure out, well, what was for me? And I knew in my heart of hearts that I wanted to be a doctor that really focused on relationships, that understood the power of nutrition, the power of our bodies to heal ourselves, and physical medicine and things like that. And so I started looking at all of these different tracks. I'm like, okay, if I go to the conventional route, then I need to take a degree in nutrition. And what about physical medicine and all of these things? I'm like, oh my God, I'm going to be in school until I'm like 70. So I just started looking at all of these different pathways. I thought, well, maybe I'll go into research. And so I just really started turning over a lot of stones in my own journey to finding my way. And my mom, in the meantime, was like kind of, in my ear, why don't you talk to this, this chiropractor? And I said, I don't know that I want to be a chiropractor. I really want to be a doctor. And so I finally caved in and spoke to him. And he was so gracious and so wonderful. And he actually told me he had gone through a number of additional trainings himself, acupuncture school and nutrition and a whole bunch of other things. And he said, there's this other pathway called naturopathic medicine. And this light bulb just went off as he started to describe it. I'm like, oh my gosh, that's what I wanted to do. And I didn't know it existed. And so the next day I was on the phone with one of the programs, and within a week I was on a plane. So it was that quick and it was that exciting for me personally. And that's how I got to where I am. And my career has kind of taken turns and twists in academic medicine and accreditation, public policy. I was involved on the Hill in 2009 when the Affordable Care Act was being passed as legislation to work to get integrative medicine included. So it's really been kind of a twisty, turny career of mine, and I've loved all of it. And so I'm excited here to talk to you a little bit today about what NDs do and how we work. And if you have more questions, I'll put some contact information on at the end. So naturopathic medicine is guided by 6 principles. These are really the foundation of everything. So from the start of naturopathic school, the full 4 years of it, this is woven through even your academic courses like anatomy and phys. And so first do no harm is inherent in naturopathic medicine. And this typically means that we're going to try and utilize the most gentle approaches to care. Naturopathic doctors recognize the healing power of nature. And so very often, any approach that we're going to take is going to have that in mind, whether it's the person's own inherent nature or that which we use to help them heal. Identifying and treating the root cause was something that really excited me about naturopathic medicine, because I had very much in my own health and the health of loved ones seen, a diagnosis and a treatment, but not necessarily understanding the why. And back when I used to have naturopathic students in clinical rotations, my students lovingly nicknamed me Dr. Y, but not because my name is Yanez, Dr. WHY, because I always wanted them to know why the person was sick. And so that was their own little jab at me, always asking them why. And I was like, you're Dr. Y. I'm like, I know, because you need to know why. So the why is identifying and understanding the cause. And very often, I always use this example of headaches. So how many of you have had a headache? Yes. lots of different reasons why you can have a headache. So, assuming it's not anything life-threatening, you might take some sort of an NSAID or, some type of anti-inflammatory for the headache. But that doesn't get rid of the reason why you got the headache in the first place. Is it tension? Is it water? Is it hormonal? And so when a naturopathic doctor is working with a patient, they're looking to that root of the issue and to understand. And then they will go to the next one, which is physician as teacher, helping to teach the patient why it's showing up and what to do to prevent it. And so that's part of the prevention piece. And then treating the whole person means that we're looking at everything. So when you see a naturopathic physician, they are looking at the totality of the person. It isn't just the symptom that brought them in, the chief complaint. It's really everything. It's your sleep, your stress, your bowel movements, your sexual activity, your jobs, your family support, all of it together, and what is showing up as a symptom in you could be coming from lots of different places. So the therapeutic order is very much core to naturopathic practice. I always like to think of this slide, and my subtitle for it in my own mind is how a naturopathic doctor thinks and how we approach a patient case. And so if you look at the bottom of the pyramid, that's establishing the foundations for health. This is the determinants of health, things like stress, sleep, nutrition, physical, movement, lifestyle factors, and so on. And so when a naturopathic doctor is focusing on patient care, they're usually going to start there. Now, the high force interventions, things like medications, surgery, etc., are at the top. Now, it doesn't mean that we don't do them. It doesn't mean that they're not part of the patient care in the case. It's just typically we're not going to go there first. Now, that said, I've had patients come in. I am no longer in clinical practice full-time as the executive director, but I've had patients come in that were emergent. I've had, active miscarriages currently in place, things that were suspected appendicitis. Guess what? We're going to red. We're going straight to referral and appropriate care for that. But most of the things that are going to come in are typically going to be well served at the bottom of this pyramid. And that's the point. Much of what NDs see is the chronic conditions, chronic pain, things like hypertension and diabetes, hormonal disorders, things like fatigue and depression and anxiety. Those are the types of things, gastrointestinal stuff, all of those itises that come in and are often really well served. So one of the things that I saw in my classmates, and I'm married to a physician, I'm married to a medical doctor, but one of the things that I saw in my classmates that was different than the medical students that I've seen sometimes is very much there was this desire to have this holistic approach. And so, really focusing on all of the different pieces, really developing that relationship with the patient is very valuable and important to folks that often go this route. So, the science and the art of medicine is something that I think many ND students are drawn to. The fact that you can personalize how you practice, you can create this practice that makes sense for you. And so in my class alone, my class of 50 students, we had folks from all different types of backgrounds, first off. Everything from traditional pre-meds like myself to second career folks who were in nursing and all different types of backgrounds. There was even an old construction worker who was one of my classmates, some massage therapists, an accountant, an engineer, there was everybody. But one of the core kind of threads with all of us was that we wanted to individualize this. There was an art to the science as well as the science. There was also a lot of social concerns, connectedness to the environment, and really wanting to make that difference, and not so much as worried about the status of being a doctor and being called a doctor and being a physician and what have you. So those are just a few of the things that we've seen. Some folks came because of cultural backgrounds, like myself. I'm Cuban American and also Russian, and on both sides, there was a lot of the traditional medicines, like grandmas would be making teas and all that kind of stuff, and so much of what I saw in naturopathic medicine was already very familiar because But it was the evidence component. So like, whereas grandma might have been making the tea, now I understand why the tea works, or the chicken soup with the garlic in it. Okay, now I understand the actual components of allicin in the garlic and why those are antiviral and why they'd be used in a soup when you're sick. Makes sense. So many times we'll see people who are inspired by the things that they've seen in their life's experiences. So as I said, the age distribution, we have many conventional pre-meds, but then we also have a fair number of career changers that choose this. In majors, lots of bio majors, but also lots of folks who take other routes. And I think that's why we're here today, to understand all of the different ways that you can be a health practitioner. So in the ND curriculum, the first 2 years are very similar to conventional medical programs. I like to call them all the ologies. There were a lot of late nights in those first 2 years. I will admit that. Lots of classwork. So all of the ologies, anatomy with human dissection and phys and biochem. But the one thing, remember, I talked about the principles. So in these first 2 years, those principles are being woven through everything. And so biochemistry is going to be taught biochemistry. Like I always joke, in anatomy, the bones don't move because you study them in naturopathic school. The nervous system doesn't change. Like the nervous system's the nervous system, biochem's the biochem. But there is an emphasis in naturopathic school to cover the interconnectedness. So if you're talking about the biochemistry of the liver and metabolic pathways, that's also going to relate to the hormonal and the endocrine system. And it's going to relate to detox pathways and what you eat. And, and everything is going to be woven together. And so, in these ologies, you're laying the foundation, the framework for understanding how it's all connected. Does that make sense? And I know we're all on mute, but yes. This is weird. I'm used to being in a classroom where I can interact with people. So you see I'm talking with my hands a lot, and I'll be moving because I'm just used to being in front of people. So anywho, don't mind me and the hand motions. That's my old New Yorker. I can't get rid of her. So long story short, the first 2 years are very focused in laying that foundational framework. There's pharmacology, neuroscience, human path, et cetera. And so you're laying the framework to be able to diagnose and treat. And so diagnosis is also very similar. So there's the clinical education focuses on diagnosis, triage, and all of that. But the difference and the wonderful thing is that in that clinical education, along with all of the diagnosis and treatment, you're learning how to do so and address that root cause, like I talked about, and do so with natural medicine. And so in the clinical component, there's a minimum of 1,200 hours. Most students do more than that. And that's going to occur right now in the time of COVID. It's a bit more telemedicine focused because everything has had to move online. But under normal circumstances, there are lots of community shifts, lots of medicine out in the community, in addition to the academic medical centers, and really exposing yourself to how to apply what you've learned in class. And so the therapeutics that you get, nutrition, as I said, usually at least a couple hundred hours, mind-body medicine, lifestyle counseling, hydrotherapy, homeopathy, botanical medicine, and manipulation. There's also IVs and minor surgical procedures and all sorts of stuff that will get woven in the ND therapeutics and the clinical component of the education. So like I said, it's an intense program. Many of the schools also have dual degrees. And so while I was in school, I also studied acupuncture and Chinese medicine. And so I was doing both together, which was insane, but awesome, because I was getting to apply everything all the time. And, I would see my Chinese medicine cases, but I would also be thinking in my head, okay, what would I do if this was just a straight naturopathic shift? And so it was kind of double the focus in my own head of how I would work through cases. And it was just more tools in the tool belt, honestly. As we see in naturopathic school, this is from a survey that AANMC did this past year, and really showing the areas of focus. And honestly, it demonstrates, like when you look at other health professions, you'll see people who will choose specialties of like surgery or ortho or derm or what have you. But to say that 64% of NDs have some component in nutrition and digestion recognizes that, at least in the naturopathic approach, like I said with that therapeutic order pyramid earlier, so much of the illness that we see is rooted in digestion, in assimilation of nutrients, in making sure that that foundation for health is intact. And so you'll see that a very large majority of NDs are focusing on the core of health. And so you've got folks in nutrition and women's medicine and endo, insomnia and fatigue. But I don't know too many people who have not dealt with insomnia and fatigue at some point in their life. So no surprise that many of these things are very common complaints that NDs work on. So the prerequisites for naturopathic school, undergraduate degree with science prereqs, and you do need to have a very strong science background. As I said, those first 2 years are intense, and we want to make sure that the students are adequately prepared for them. But then, other things, sometimes students will say, well, I have the pre-med degree already, or I've got the bulk of those courses. Are there any other classes that would be helpful? And I tell folks, there are a handful of classes that I would recommend. If you do have the chance to take some biochem, or to take an anatomy course, to at least start, that first year will be a little bit easier for you, because that first year is intense. I used to teach anatomy and physiology, and I actually referenced on my very first day of class with students that they weren't taking a science class, they were taking a language class, because you were basically learning how to call things names in the body. And it was a rote memorization course. So, yes, there was the physiology part of anatomy, that's more of the science, but anatomy in its own is really very much a language course. And so the more you can bolster your sense of those things beforehand, the easier it's going to be. The other coursework that can sometimes be helpful for students is taking some business classes. And even if, regardless of where you want to go in your life, a few business classes is always helpful to have an understanding of how to read and negotiate a contract, how to present yourself, how to read financials and understand financial profiles of things. Even if you're not going to open up your own business, those are really good tools to have. So the prerequisites I already talked about. If you are thinking about this as a pathway, I always tell students, talk to an admissions counselor early on, even if you're not, for sure associated that you're going to apply to a school. Start to get an idea of what your academic plan would be, what courses you might still need to take, and so on. So the GPA, as I talked about, prerequisite courses, I'm going to keep skipping here. So the accredited programs in North America are on our website. I'm not going to belabor it at this point. So if you have any questions, additionally, AANMC.org has all of this info that I'm covering as well. So application materials are very consistent. There's going to be an essay, there's going to be an application, and more than anything, the application team or the admissions team is looking to see that you've done your homework and that this is really the path where the light bulb went off for you, that this is what you want to do. And I think honestly, any program is going to want to really see that you are committed to that track, to that school, to that institution, and that it's not a plan B, but this is really your A plan. The other piece of this is that the MCAT is not required. And so we will take a look at MCATs if they are there, but that's not a requirement for application. And right now, in-person interviews are waived for the most part. So a lot of schools are going to the virtual interviews, but it's best again because things, travel restrictions are changing nonstop. So I always just tell folks to check in with your programs and find out what they're doing right now, because the whole world went upside down on March 13th. So now I'm going to talk a little bit about patient care. And I was trying to think about what kind of case I wanted to talk to you all about. But what I will say is when a naturopathic doctor sees patients, that first office call, usually there's a pretty thick intake. And we've all filled out intakes for doctors, but our intake goes into a lot more detail on things like sleep and lifestyle factors and what you're eating and how you want to, how you want to get better and why getting better means to you. And so that first office visit with an ND is typically going to be between an hour and an hour and a half, if not more. And the reason for that is because we get into all the nitty gritty, and there's a lot of questions that go into much more depth. I think of one so I did a residency after my naturopathic school and my program, and one of my supervisors, I will never forget this assignment. So here I am, I'm thinking I'm a pretty good student, and he stumped me. He said, "Okay, JoAnn, I want you to go in to this patient case, but the only things that you are allowed to say in there," and they had, by the way, it was the closed caption room, so there was a video recorder, so he could see if I was messing up. And he said, he's like, you can say two things. And I kind of looked up at him like, what do you mean I could say two things? How do you go into a patient room and only say two things? And he said, you can say, uh-huh, and tell me more. And at first I was stymied. I was like, oh my God, like, what does this man think? What is he thinking? How am I going to go in to a patient and say two things? And I knew he was watching, so I knew that I couldn't get away with like sneaking around and doing anything else. So I go into the room and I interview the patient, I start talking, and I followed the rules. And I said, okay, tell me more. Mm-hmm. And tell me more. And I just continued to do that. And by the end of the visit, the patient was crying. She said, nobody has ever listened to me like this. And it was so powerful because I realized how much, as a doctor, I often interrupted patients. And it was just such a powerful moment for me to see what listening and how healing listening could be. And so the first office call is usually going to be long because we're sitting there, we're listening, we're eliciting the stuff that maybe people didn't feel safe sharing. And then those return visits are also usually going to be a little bit longer too. And so in that first visit and in those follow-up visits, there's a complete biopsychosocial history, physical examination, labs. Sometimes I would be the primary care doctor for somebody, so I might be doing their annual pap smear. I might be, doing their skin cancer screenings and what have you. Or I might be doing acupuncture. I might be doing something totally focused. I might be removing a toenail that was ingrown. Like there was all sorts of things that fell in there. As I developed my practice, I got much more into cancer and HIV medicine, and so it very much took a turn, and I really got focused in seeing hepatitis and HIV patients. But it was what I will say is, there were so many lessons. As you become a doctor, yes, we're here to help people, but there's also times where you learn. And I'll give you an example. I'll give you one patient example of a time where I learned. So I was at an HIV center, and I had a student shift of, I think there were 6 or 8 students with me. And my front desk person comes over to the back area, like staging room where we were at, and says, Dr. Y, there's somebody who came in, they didn't have an appointment, but would you see them? And I said, sure. Well, we'll make some room. And so I walk into the room, and the gentleman was homeless. He was, very disheveled, and, just, you could tell that he hadn't had a square meal and a good night's sleep in a while. And but he was also kind of belligerent. And so, we're in like a little outpatient clinic. Like this isn't an ER, this isn't someplace with security or anything like that. And so I told my students, I said, go ahead and take the rest of the patients. I'll at least work this up, and then we can powwow afterwards. And so, as I'm taking the history, he is going on about how he'd been in prison and how many people he'd killed, and how he just recently, had to kill somebody to stay alive underneath a bridge. And I could tell, sometimes you have people who, I think of it like dogs, where, dogs bark because they want to show their strength and their dominance. And so, there was a part of me that was wrestling with this. I'm like, okay, should I be scared? I'm a little petite female in a room with somebody who's talking about killing people. And, how do I handle this myself? But I sat and I listened, and I ended up doing a little bit of acupuncture on him, and I didn't bring the students in at that point. I just said, you know what, I'm just going to do some acupuncture. And, I remember cleaning him up and getting him some resources. I said, here are some places where you can get food. Here's some food banks. Here's some, things that you can do to if you want the help. And he was a Vietnam vet. He was, you could tell there was humanity there. And so at the end of the visit, he left, and I honestly didn't really give it too much more thought. We went along our business and saw our patients, and I don't know, maybe a month or two later, my front desk person comes back over to me and said, Dr. Y, there's somebody here. He doesn't have an appointment, but he wanted to just see you really quick. And do you have a moment? And I said, sure. So I walked into the waiting room, and I didn't see anyone I recognized, but there was a man in the corner, and he came over to me and said, and he could see that I didn't recognize him. And he said, it's me. And he gave his name. And I said, oh my gosh, you look great. He had shaved. He was clean. And he just wanted to share with me. He didn't want an appointment. He didn't want to be seen. But he just wanted to let me know that after the visit, he went and got help. And he was in a halfway house and started counseling boys who were at risk. And he just wanted to come in and check in and say thank you. And it was all I could do to not well up inside, because I knew inside I was judging a little bit. And, I was like, oh, here's a homeless person who came in. And I will say that taught me, and I'm being humble with you here, but that taught me we're all human and we all have thoughts and feelings. And it taught me that there's humanity everywhere, and we have to be open to that. And it's very easy in medicine to get jaded. It's very easy to think, oh, here's another person who won't quit smoking, or here's another person who won't X, or whatever. And that's a moment where, as a physician, you need to check in with yourself and get grounded again. One of the pieces of advice that I always give students, regardless of their profession, where they're going, is write down on a piece of paper, take out a piece of paper and write down your why. Write down why you're doing this. Why are you going to school? Why do you want to be a physician, or whatever fill in the blank career you want to do? But write it down, because there are going to be times in your life that are going to make you question it. And you're going to need to pull out that piece of paper again and remember and remind yourself why you're doing this. There's going to be tough times. There's going to be tests that you fail, or patients that didn't work out the way you thought they should. And reminding yourself of your why is going to be really important to keep you on track. There may be folks that try and dissuade you. I know when I started on the naturopathic path, I had some family members say to me, well, why don't you just be a regular doctor? And I said, because this is what I'm called to do. This is my passion. And it's so funny, from time to time when I talk to students, they'll say that to me, like, oh, my boyfriend's mom is, asking me why I'm doing this. And I think of my best friend from undergrad. He became a dentist. And he had folks saying, well, why are you going to be a dentist? People hate their dentists. I have a friend of mine who's a teacher. People say to her, why are you going to be a teacher? They get paid so horribly. There's always going to be somebody in life that's going to try and knock you off. And it's up to you to stay on track. And so regardless of what that track is, for me, this was my path, but everyone has their own path. And so it's really being mindful of your why and what you're passionate about and what your role and your place is in the world, and sticking to that. And so for me, this was the route. And maybe for some of you, this might be the route or not, but whatever your path is, don't let folks knock you off of it. So I know that we have a few more minutes before we go to question and answer. but I wanted to talk just about some of the career options, because when I started school, so I'm again going to age myself here, there was no internet. So, well, there was, but it was really kind of wonky and not something that you found a lot of stuff on. So I didn't know all of the options that I had, and as a doctor and as an ND, and I love the flexibility that I see with my colleagues and in my own career. So in addition to clinical practice, there are NDs that become research scientists and get federal grants. There are folks who go into the supplement industry where, they're either formulating supplements or working with, the supplement companies and in that industry. Folks that go into administration like myself, folks that are more entrepreneurial and start up their own businesses and, or become consultants. For a while, I was consulting with hospitals that were starting integrative medicine programs. So there are all sorts of different ways that you can use the degree. There are people who like to do education, and then there are folks who like to do a few things at once. A lot of times I'll hear from my colleagues, I don't know if I want to see patients all day, every day. I love seeing patients, but maybe not 5 days a week. and so what they might do is they might have a clinic where they're working and seeing patients part of the week. And then maybe they're doing one of these other things. Maybe they're writing, or they're speaking, or they're teaching, or they're doing admin part-time, and kind of patching together a career that makes sense. We conducted a survey this past year, and there were a few things that came out of it, but one of the things that we saw was folks really appreciate the flexibility in work-life balance that you can have as an ND. And so, when you're thinking about your career, it's not just a career, it's a lifestyle. And what is the lifestyle that you want to create for yourself? When I was in ND school, I was on my clinical rotations for labor and delivery for OB, and had a family that I followed, a woman that I followed all throughout her pregnancy, the whole way through, from start to finish. And we got to, and I loved it. I loved the visits. I loved working through things with her. And then I had the old pager, and I was on call for a month. And while I was on call for a month, I realized, wow, I don't want to be on call like this. Like this isn't what I personally, this isn't the lifestyle that I would want for myself in practice. And, because I had to be on call 2 weeks before her due date and then 2 weeks after her due date. And she was almost 2 weeks late. So I was basically on call for a month. I was like, oh, I can't go for a hike. Cause like if I'm all the way up on a mountain and I get the page, I can't get to the car in time. And so I just realized that wasn't the kind of lifestyle I personally wanted, even though I loved, in the moment, being with a woman going through that transition. It was just such an amazing thing to be a part of. I knew that as a career, I didn't want to do that, at least as part of ND school. So I always tell folks, talk to as many docs as you can, like look at all the different ways that you can use whatever it is you're trying to do, and find mentors. And find people who you can talk to, who can help you on your path be the best version of you. And what that requires is honesty. Like you need folks that are going to be honest with you and say, what do you think your strengths are? And this is what I'm seeing, because we all need feedback, everybody. So career satisfaction is another thing that we see a lot of NDs really feeling satisfied with their choice. In relation to other professions, usually not so high. So, we hear from, USA News and Report, all of the different news channels that will talk about career satisfaction or dissatisfaction with a lot of paths. And we tend to have much higher satisfaction rates because, again, when you feel called to something, there's something so inherently satisfying in doing that, and for it not feeling like work because every day is just fun and cool and filling your cup. So at the AANMC, we have newsletters, we have free monthly webinars that are available to students, and so it's a really good place if you're just thinking about this or wanting to know a little bit more to stop by and sign up. We have a webinar coming up on depression, and then we host virtual fairs with all the schools. And then in December, I think our webinar is on seasonal flus and how to stay healthy during cold and flu season, and not specific to COVID, because COVID's brand new and we're all still figuring out how to work with this, but just like your traditional cold and flu season. And so here's our contact information. If you want to find out more about us or get a hold of me, feel free to reach out. And let's see. And I think that was all I had. So I finished a little bit early.
Thank you so much for that presentation. It's super informative. We do have some questions in the chat. So at this time, students, we are going to be beginning our Q&A. If you have any questions that came up during Dr. Yanez's presentation, feel free to go ahead and drop that in the chat, and our hosts will go ahead and start reading those. So Raphael, are you ready?
Yeah, since you aren't doing as much clinical work, what do your typical work days look like?
Right now or normally?
We could do both. So they know what like pre-COVID looks like too.
Okay, so the world pre-COVID, what was that like? So pre-COVID, as an executive director, so I'm an executive director and I work as kind of the puppeteer, so to speak, the traffic director of all of the committees. So AANMC is the member organization for all of the naturopathic medical schools. So I help to coordinate if there's a collective research project, curriculum issues. So my typical day would be meetings with anything from college presidents to deans and admissions folks, residency directors, admission staff, different committee members and all of those folks, and kind of coordinating the projects that they're working on and providing leadership and direction. There's networking, there's legislative work that's part of that. So, there have been a lot of executive orders that have been coming out recently that have implications in education and healthcare delivery. And so there's been a lot of work that we've been doing as a result of that in the past, 6 months or so. And then, there is, under normal circumstances, there would be travel. So I might be going to conferences or speaking and presenting at different events. And so under normal circumstances, I'm typically traveling about 20% of my time, and then, working and doing meetings and other things the rest of the time. As an executive director, there's also administrative work. So I might be preparing budgets, preparing strategic planning, leading strategic planning. So there's been a lot. So throughout the course of my own education, yes, I went and got an ND and I did a residency, and I also studied acupuncture. But I went and got a master's in public health later on. And because I recognized I loved, so kind of throughout the course of my life, I practiced, I taught, I got into academia and accreditation, I got into public policy, and then I'm like, wow, I like public policy. Who knew? I didn't know. And so I went and got my public health degree. And when I started this position, I realized, I have never run an organization before. I've been on boards, but I didn't run one. And so I realized I wanted to increase my own education. So I went and got the certification from the association, the Society for Association Executives. And that was helpful for me to better understand the inner workings of being an association executive as I am now. And so, I'm a member, and AANMC is a member, and I'm the representative with all the other healthcare association executive directors. So pharmacy, medicine, dentistry, and so on. And so we all meet. So there are all different types of things on a normal day-to-day that would be part of my job. What I will say is COVID, and I'm sure any of you in school, you got the student end of it. But on our end, basically, our first school closed actually on March 7th to campus courses. And so on the back end, we were in San Diego at our annual meeting, and just, crisis management. So it was immediate crisis management of how do we close all of these campuses, keep our students and our staff and our faculty safe, get people back from externships, it was kind of like traffic control. How do we shift all of our courses online? How do we, close clinics and make sure that our patients aren't abandoned? And so, COVID really posed challenges to those of us in healthcare education. I liken it to 9/11. I have a good friend of mine who was an air traffic controller on 9/11 during 9/11. And he was in the greater DC area and basically had to land everybody that was up in the air. And that's kind of what I felt like. It was not 9/11, but I felt like we just had to land everybody right away and get everybody down and off clinic shifts safely. And so since then, it's been working with accreditors, working with testing agencies, making sure that the students can continue their education, get their tests, get licensed, get graduated, start working, be successful, all of that in light of all the changes that have happened. So the days have been longer. The Zoom calls have been more frequent. Zoom fatigue is real. So, but one thing I will say is that I am grateful for my naturopathic education, even though I'm no longer practicing. In the beginning of all of this, I started having neck pain. I started having like weird elbow pains and things. I'm like, what the heck is going on with me? Like, why is my body reacting like this? And I realized I was like, oh, I'm leaning on my desk because I'm at my desk for like 14 hours a day. And so, I just I had to tune in. I had to use my own medicine on myself. And so Dr. Heal Yourself is something that it was actually a class we had. So I personally realize the value in my education, not just for patients, but for myself. And I hope that answered your question about my regular day, because it's not regular right now, but.
Yes, thank you so much for that. So our next question would be, did you teach and work as an ND at the same time? If so, how did you balance these two responsibilities?
I did. So when I was in my residency, part of my responsibility as a resident was to take on, TAing some classes and teaching some classes in addition to the patient load. And so in academic medicine, there's usually a balance of both of those, where you're doing some teaching, and even if you have students on your shift, you're still teaching them, you're helping them learn their craft. But you do it, it isn't too much different than, anything else, where you just have to learn how to prioritize, and balance, and, and figure out how also to take care of yourself and to keep yourself okay throughout it. But you do it. It's really not that tough.
Another question is, what is the difference between osteopathic medicine and naturopathic medicine?
Good question. That's one that comes in quite a bit. I always leave it to the osteopaths to describe what they do themselves. But what I will say is that in naturopathic medical school, the focus on holistic medicine is from day one and throughout the entirety of the coursework. And so, yes, we're getting diagnosis and treatment from a conventional model, but when we're seeing patients, it is always from the naturopathic paradigm, and it's always from this holistic paradigm from start to finish. And so with naturopathic medicine, it to me is the most direct way to become a doctor if what you want to do is to be in integrative medicine. I have friends of mine that work at the Osteopathic Association. I have friends of mine who've gone through the osteopathic program. One very good friend of mine is a dermatologist, and she does conventional dermatology. So, if you're interested in very much the integrative medicine model from day one, and that's what you want to do, this is the most direct way to do it. Did that answer?
Yes, it did. Thank you so much. So our next question would be, when or why would a patient go to an ND versus an MD?
Good question. So naturopathic doctors are primary care physicians who specialize in natural medicine. So you have patients who see NDs as their primary person, where that's where they go for their well checks. That's where they go for their annual PAP or their pelvics or, whatever it is that they're needing for their annual visits. You also have people who recognize that they want a more holistic approach, and they want somebody who is going to address all of the different facets in their life, whether it's mind, body, as I talked about, stress and sleep. And so typically the patients that are drawn to this, and it's growing too, when I was a kid, it always makes me kind of chuckle when I say that, but when I was a kid, the only place where you could get herbs and supplements and things like that was like the hippie co-op store. And now it's everywhere. Like you have, Whole Foods and Trader Joe's and, all these places that have organic food. And like, it's not weird anymore. It used to be kind of a little weird. It wasn't the mainstream store that sold all of this. And now people recognize that eating holistically, eating healthfully, eating whole foods, taking care of yourself, and taking responsibility for the things that show up in your body is a way that they want to go. There are a lot of folks that I hear from that want the root cause focused medicine, where they don't want to just maybe have a symptom managed and here, take this medicine for infinity. But no, I don't want to take this medicine for infinity. I want to get to the root of why it's showing up and not have to take anything. And so there are a lot of folks that are drawn to that component of naturopathic care, where they want to understand why they've had this skin rash forever, and not just take a cream when the skin rash comes up, but to get rid of the skin rash once and for all. And I'm just using that as an example, but that would be the type of folks that would come in, are really wanting to get to the root of what's wrong, rather than patching up something and kind of just symptom managing. Is that clear? And it's tough for me because I can't see all your faces and see if you're like getting what I'm saying or if you're totally lost.
No, it's totally good.
Okay.
How do you define synthetic versus natural medicine?
So synthetic is man-made, right? So natural therapies are things that are derived from nature. Usually synthetic is going to have had, and there's a time and a place. There are some components that you can't take enough, you can't get to a therapeutic dose with a natural, straight from nature thing. You might have to alter it somewhat to get to a therapeutic dose. So that's really where, synthetic comes in, but, natural is typically derived straight from nature.
How closely do NDs and MDs work with each other?
Very. Sorry, I didn't mean to be flipped there. So one of the things that we're seeing increasingly is team-based care, where it isn't just, a doctor alone seeing a patient, but very much, our graduates now are going out and they're working in team approaches where there may be a nurse practitioner, a DO or MD, massage therapist, a nutritionist, a psychologist, all underneath one roof and working in a team approach. I have a number of colleagues who had worked at the Cancer Treatment Center of America hospital chain that is across the US, and they've very much focused on a team approach where they would have conventional oncologist, radiologist, surgeon, all of the conventional team, and then they would have a counselor and a naturopathic doctor, to understand the drug herb and drug nutrient interactions, to make sure that any supplements a patient was being given would not either upregulate or downregulate the medications that they were being given and the therapies for their cancer. So very often we're now seeing NDs as part of this team-based approach, and it's very much increasing in how medicine is just practiced now. You've got electronic health records that also make it a lot easier for people to communicate, so that everybody has the record, everybody knows what's going on. Doctors can work well together via that mechanism. And you have NDs who may have specialties where they cross-refer. I've got a good old friend of mine from school who is a naturopathic oncologist, and he works very intimately with his patients' cancer doctors, with their radiologists and their surgeons and so on. So it goes both ways.
What is the timeline from applying to ND school and actually starting it?
So the application process is similar. So you'd be applying now. Schools are on rolling admission. So what happens is you apply, and based on how quickly the class fills up, there may be some later seats in some programs if students. Right now, especially with COVID, people's life circumstances are changing so rapidly that what you may have been able to do, you might not be able to do. So. We're recognizing that, but there's rolling admissions for ND schools. So, it's typically you apply, and then that following fall you would start. A few of the programs do have mid-year starts. So you might be able to start in the wintertime in some of the programs as well.
Sorry, I couldn't unmute myself for a
That's
second.
okay.
So where do the NDs work, and do they hold positions in the hospital as well as, or only in private practices?
Sure. So naturopathic doctors are all over. I think there was on our website, we have a slide on I believe it's our career page that answers that question. Typically, NDs are going to be in outpatient practices. So integrative medical centers, solo practices, et cetera, but usually outpatient. There are some that will be working in hospital settings, but mostly ND practice is going to be outpatient. And then, like I said, NDs can also be in academia. They can be working in other types of lines of work in addition to the clinical component.
Can an MD student take related ND courses and balance therapies between the two areas?
So to my knowledge right now, there is no dual enrollment like concurrently for MD and ND school, but there are MDs who have gone through the program afterwards. So, and vice versa. Sometimes student will say, I want to continue my education. We do have MDs. In fact, we had a webinar last year and the year before with MDs who changed routes and became naturopathic doctors afterwards. There's usually some advanced standing that they'll be eligible for. But they would have to go and take the naturopathic therapeutics courses because that wouldn't have happened in MD school.
So our next question would be, as you said, naturopathic medicine looks holistically at the patient and not root causes of symptoms. Why do you think this practice isn't used more widely?
It is used widely, but I think it's a numbers game. So we're a small profession. There are 100,000 plus, conventional practitioners, and maybe, a little under 10,000 for naturopathic doctors. So part of it is just numbers. The profession has been emerging and growing over the last number of years. I graduated actually 20 years ago this year. And when I was a student, there were 3 schools, and so we've doubled that, and the areas where you can practice fully have also grown. So it's a growing profession, and I think part of the piece of that is just the fact that we're a growing profession, and so we're catching up to the interest.
Just piggybacking off of that, how long has this degree been going for? Going on for?
Sure. So naturopathic medicine has dates to the late 1800s. And in the early 1900s, there was something called the Flexner Report, so a little medical history lesson. The Flexner Report was commissioned and looked at all of the medical practices, so chiropractic, osteopathic, naturopathic medicine, homeopathic medicine, and basically standardized the course of medical education in the United States. Medicine used to be a kind of like a preceptorship position where there wasn't formalized standard medical education. You worked with a doctor as an apprentice, and then you became a doctor. And so what happened in the early 1900s was medical education became standardized, but chiropractic education, osteopathic education, all of those kind of closed down, with the conventional MD being the standardized route to becoming a doctor. And so what we saw was over the remainder of the 1900s, all of these professions gradually started to come back up again, and so had to basically reemerge and pick up where they left off. And so we are an old profession. Many of the older licensing practice acts actually date back to the 1920s for naturopathic physicians, like places like Connecticut and so on. So there are some very old practice acts there, but interestingly enough, it was, kind of the numbers declined through the 1950s, and then in the 60s and 70s started coming back up to where we are now.
How would you go about finding a mentor?
Network. A lot of networking. Mentorship is kind of like dating. Like you can't force it. You can't force somebody to be your mentor. You can't force someone to, you have to hit it off. You have to have, it's got to work for both parties. And so, the way to do that, honestly, is mentorship, is network, go to different types of events. When I was a student, early on, I was trying to broaden my naturopathic my clinical training. And so I went through, I'm embarrassed to say this again, but I went through the phone book and I started calling up doctors' offices and saying, hey, would you take a preceptor? Would you take a shadow? Can I come and, watch what you do for a day? And, a lot of doctors will be open to that. Like, hey, can I take you for tea? Can I take you out for coffee or pick your brain? Just start talking to folks. Like if you have a specific area of interest, if there's something that you're looking to do, go and seek it out. They're not going to come to you. So, you really do need to be proactive about that. You can attend conferences as students, don't be shy, talk to folks, talk to vendors, talk to people. And, when it's meant to be, it'll happen. Now, there are formal mentorship programs. I was actually involved with one as a mentee through the National Hispanic Medical Association. So there are formalized mentor programs, but there are also most commonly people just kind of stumble on it.
Hi, this one is more like a comment and a question. I feel like all doctors should have a holistic approach when it comes to treating patients. Why do you think NDs are a small profession?
Thank you. I agree. I think we would have a lot better care, honestly, if we had a more holistic approach to patient care delivery. Some of it is, again, like I said earlier, the growth of the profession and, growing. Some of it has to do with legislation and reimbursement. And the reimbursement models that we have in this country currently are fee for service. So when you're sick and you have something wrong, you get paid for the wrong thing. You get paid for the thing that's wrong. But there isn't in our medical system as much of an emphasis on prevention and wellness. And so, yes, you can go in for your well check, but there isn't the reimbursement in place to have all students go for stress reduction. Everybody gets stress reduction care taken care of, or preventive massages so that you don't get muscle tension, or whatever it is. Like, that's not how our insurance system is set up. If it were up to me, every kid would have nutrition education. They would know how to cook. They would know how to prepare their own meals. They would know how to read food labels, know what they were putting into their bodies. Like it would just be part and built into our system. But our system currently isn't built that way. It's just, it's a reductionistic approach to thinking about how to manage care rather than a bottom up. It's kind of top down. Does that make sense?
Yes, thank you. So our next question would be, what was the hardest class for you during the first 2 years of your ND program?
So the first 9 months of my program, I was dumb. I worked several nights a week as a cocktail waitress to make money. And so I would like bring my books in and leave them by the bar. And like when I had like a slow part, like kind of look through my anatomy books and stuff. So it was a little bit weird for me because I wasn't like fully dedicated to only being a student. I was also working, which was exhausting and crazy, but I was 22. So, but that said, physiology for me personally was harder. Even though I did have a science background, the phys classes of just, understanding like the sodium potassium channels and like all of that kind of stuff, it didn't all the way click for me. And so I had to work at it. I got it, but I think for everybody, there are going to be some things that are going to come more easily to you. Anatomy was kind of easy for me. It's like, oh, this is just like learning a language. You just practice, locations and so on. I don't know. I loved biochem. So I don't know. I would probably say phys just because of the technicality of it. But I think everybody's going to be different, honestly. And the other thing too, hopefully at this point, you've already figured this out for yourself. But if you haven't, figure out how you learn because you're not going to have time in medical school to figure out how you study and how you retain mass quantities of information quickly. So, hopefully you have figured that out by now. But if you haven't, do it quick because by the time you get to school, there is not going to be time to figure out your learning style or, how you retain information. Like, do you need a group to study or do you need to be totally quiet by yourself? Get that worked out now so that you don't waste time because in medical school, you will not have the time to waste. You need to kind of get it down and figure out how you can learn as fast as you can.
Thank you. Can you talk about the ND school tuition and how much it costs?
Sure. So tuition is going to vary by program. So we have a page on our website. We've got links to that as well. But typically tuition is going to be anywhere from like low 20s to low mid 30s per year, depending on the school and the location, and cost of living and so on for certain areas is different than others.
Thank you for that. So would pharmacy industries look down on this type of treatment of naturopathic treatments?
You'd have to ask pharmacy industries. I'm not sure. I think, like I said earlier, I'm married to a physician. He's actually a hospital administrator now, but retired ER. And, I respect what he does and he respects what I do. And I think, if somebody's in a car accident, bring me to the vascular surgeon, bring me to the ER. Like I want the best there is. But if there's, underlying metabolic syndrome or diabetes or chronic disease, NDs are very well equipped to manage that. There have been wonderful breakthroughs in pharmacology that have saved lives. And so, I think that there have also been wonderful, amazing breakthroughs in natural medicine that have saved lives where other routes couldn't. So I don't think it's that one is better than the other. It's that there's a place for all of them. And it's ultimately about the patient, right? It's ultimately about what is best for that person and what's going to get them the best quality of life and have them manage the best. Like, that's what it's about. Like, it's not about me or what I think about pharmacy or what they, it's about the patient.
Can you talk about how the ND degree has changed over the years?
So, I think the team approach is definitely very much more prevalent now. And so we're seeing a lot of that team-based approach to care. Telemedicine is something that wasn't even an idea 20 years ago. Maybe you had a phone visit here or there, a phone follow-up with a patient, but seeing a patient on a Zoom, or seeing somebody physically, I think the technology piece of things has improved and increased over the years. Utilizing different technologies to incorporate into patient care is something that did not exist for anybody, honestly, not to the degree it is now. And so those would be probably the biggest changes I've seen.
Thank you. So our next question is, how has naturopathic medicine improved studies for cancer research?
So, one of the things that I hear is, oh, well, is there evidence for this stuff? And, yes, there is. There is a fair amount of literature around natural therapies for all different types of conditions, including cancer. There is growing evidence as well. And, I think that there are a lot of opportunities for people to learn. Sometimes, there's a bias in there are biases in life, the riots in June, the things that we've been seeing recently in the news. There is a fair amount of bias in life. And one of the things that I've realized in medicine is there's a bias in medicine. And we very much have a Western bias in medicine, where sometimes studies from other countries may be discounted because they've occurred in other countries or in other cultures. And so when I hear from folks, oh, there's no evidence for this, I'm like, are you talking about the thousands of studies in China? Or are you talking about, thousands of studies in India? Or like, what are you talking about when you say there's no evidence? So on the contrary, there is a strong amount of evidence. It might not be the traditional Western model that we're used to, but I would encourage people to look at the different layers of evidence, right? So there's your double-blinded, placebo-controlled, study, the gold standard study, but then there's case reporting, there's, all different levels of evidence when taken in their totality give you evidence. And so it's interpretation of all of the different layers of evidence that can help inform practice. And so, yes, there's that gold standard, but there are also many other ways to look at evidence. And so when I think about oncology, to go back to the question, there are a lot of studies that exist that are the gold standard studies, and then there are also additional studies that have been done looking that are still emerging and in the pipeline that are part of it that demonstrate very good support for many different types of therapies. There are things that are done in Europe that are very standard treatment in Europe that may not have caught on as much here. But you've got very developed countries doing things that, in Europe, but it's in Europe. So, I would just encourage people to recognize the bias and just be open to looking at a global view of how healthcare is practiced.
This is a kind of a long question. In the future, how do you think naturopathic medicine will influence education in grade school in terms of incorporating more focus on nutrition, health, and mental physical well-being?
That's my dream. That's honestly my dream. If you think about a true preventive model to healthcare, you start with education. And one of the big things we see, even with COVID right now, we're seeing, major health disparities in certain parts of our population in this country, in African American and Native American and Hispanic populations. The health disparities and the education disparities that exist are exacerbated. And so in my utopia, in my perfect world, I would see us starting with kindergartners, preschoolers, education, hospital cafeterias should be the healthiest place to eat. School cafeterias should have the best food. We should be modeling what we want people to do. and making the healthy the normal, not the healthy the weird. So in a perfect world, that would be my wish, would be to see this as part of all of the education. But instead you have, education budgets being cut, teachers' salaries being cut, those are, it isn't an area where, as a society, that we have valued with our tax dollars to the extent that it would need to be to support those things we're talking about. So ultimately, get involved, run for office, call your elected officials, get involved, because it does take policy oftentimes to make those types of changes.
I'm sorry for the background noise, but the next question would be, can you go more into depth about the requirements to get into ND PhD?
I am not aware of, I know that there are some schools that have affiliate programs with other additional PhD programs. So that would be something that would probably be best to run through the admissions groups at each one of the schools and what ND PhD programs they have available. Just like you would at, any other program, there might be a PhD, but it might not be a PhD in something you want to be a PhD in. So you need to, just call the admissions folks and find out more info on that. And ultimately, what is your career goal? What do you want to do with the PhD? Do you want to be a researcher or teach? We have, I think of a colleague of mine, Dr. Wendy Weber, who is at the NIH, and she has a PhD and an ND as well, but does a lot of the alternative medicine, the integrative medicine research at NCCIH, which is the National Centers for Complementary and Integrative Care Health at DC. So, there's all pieces that you can utilize with that PhD, but ultimately, where's your goal? What is it taking you to?
You talked about insurance a little bit earlier. What type of things are typically covered for naturopathic treatment versus things that aren't?
Insurance is an insurance plan by insurance plan kind of thing. And so it's going to vary by state and plans. I would love to see more insurance coverage. I think that there are some states that are really good with insurance coverage for NDs, but it's the big equalizer, right? If you have insurance coverage versus if you don't have insurance coverage means what is your discretionary income going to be able to afford? The one area that there is not insurance coverage for right now is Medicare. So NDs are not covered by Medicare, which means that our older patients have to pay for it themselves. And that is definitely one of the limitations, but there has been at least increasing insurance coverage over the years. So things like your well visits, your follow-up visits, all of that's going to be covered, usually depending on the plans that you have.
Thank you. So our next question is there a higher or lower number of lawsuits in ND versus MD?
So I don't have the current malpractice data in front of me. My understanding is that, so I can speak to, think about car insurance for a second. So if you have car insurance, let's say you're an 18-year-old male with 3 tickets versus a 50-year-old male with no tickets and a perfect record, who's going to have higher insurance? So when we look at naturopathic medical insurance, our insurance is typically at the lowest end of the malpractice insurance scale, which if you're thinking about risk, the types of things we do are usually very low risk procedures. So if something goes wrong with nutrition, it's it's not a very high risk thing to be working with, versus brain surgery. So, if you're thinking about the relative risk of naturopathic practice, we tend to be on the low end part of the scale for malpractice insurance costs. And so if I were to use that to extrapolate out the risk, we are going to be on the lowest end typically for practitioners for risk.
Can you talk about some interesting cases that you've been a part of?
Sure. Any specific areas?
Just like the ones that like was embedded in your brain. I don't know if I said that right.
Okay. Yeah. So let's see. Pain. So I was a new student and I was just shadowing. So I was just kind of on the observation. And there were a couple cases that came in with back pain, like excruciating, on disability, can't go to work, can't do anything, really impacting quality of life type of pain. And in one of the cases, the gentleman was actually carried in by his family. He had this awesome, so if those of you who are Latino or come from cultural backgrounds, like 10 people came in with this guy. Like his whole family came in on the visit with him. And, a couple of his family members literally had to carry him into the room because he was in so much pain he couldn't walk. And so we worked with him. We did some physical medicine, we did some acupuncture, got him some supplements, and he walked out on his own. And everybody who was in the waiting room, they started clapping, and it was so awesome. It was just one of those, he literally was carried in tears and was able to walk out on his own. And that was one of those early moments for me as a practitioner where I'm like, wow, this stuff really works. This is so cool. I had another gentleman who was on disability, same thing. He couldn't go to work. And after the treatment, I, as the student, was tasked to call him up and follow up and see why he didn't make his next appointment. And he said, "Oh, because I'm better." I said, "You're better already?" He said, "Yeah, I got on my bicycle. I'm all good. Thanks." So, there are things like that that really stand out for me. When another one was a female that I saw. She was in her 60s, and her chief complaint was insomnia since she was a little girl. 60-year-old woman with not being able to sleep for basically her entire life. And she had seen everybody. She had gone to counseling, medical doctors, acupuncturists, she did the works. And so I saw her and worked through, just kind of did my normal history. And part of me felt that there was something deeper going on. And so I led her through a guided imagery meditation. And what ended up happening was, through the course of that, she realized, I asked her to go to some place where she felt safe. And she said she never felt safe. And I said, "Tell me more." And what came out was that she was a victim of ritual abuse as a child. Her parents were in a cult. And bad things happened at night. And so she was hypervigilant. She couldn't let go of control of trying to be safe. And she had a younger sister, so it compounded it because she felt responsible to keep her little sister safe. And so she couldn't relax enough and feel safe enough to relax, to close her eyes and go to sleep and be vulnerable while she was being asleep. And we worked through that. And she was able to sleep. And so for me, you can't fix the abuse. You can't go back and take care of that child, but you can give an adult the tools they need to manage it. And so for me, that was really, really powerful. Just one of those where, I was the conduit. I was there just to help. I don't heal people. I don't fix people, but I give them the tools that they need to do it.
That's wonderful. Wow. So our next question would be, what type of cases would you use herbal remedies? I'm so sorry.
It's okay. Welcome to working from home, right? So herbal medicine is used in so many different types of concerns. Many of you have probably used it yourself and not even thought of it. If you've drank chamomile tea to help you relax at night, or taken a mint for an upset stomach, guess what? You used herbal medicine. So, I think there are a lot of ways that you can use botanical therapies, and historically, throughout history, throughout many different cultures, in the world, we have the very broad evidence for use of natural medicine, whether it is, think of digitalis for heart. Well, guess what? Digoxin comes from the foxglove plant, which has digitalis in it. So, there are very broad uses for herbal medicine, and one of the things that you get in ND school is a really substantial botanical medicine education on the uses, the contraindications, the drug supplement, drug nutrient interactions, so that you can manage that, depletion of other medicines, all of that. So I don't want to say everything, but kind of almost everything.
Thank you. How do you manage stress as an ND?
Stress? What's that? Oh gosh. Welcome to COVID, right? So for me personally, like I have he just turned 8, but I've got an 8-year-old at home. He's, March 13th was his last day of school. I work 14-hour days. And like I said earlier, I had to tune in. I had to use, practice what you preach, right? I had to turn in and figure out my own stuff, and also for him too. This is a stressful time for everybody. And, I give thanks for the things I have. I have a job, I have a home, I got food in the pantry. There are things that I don't have to worry about that maybe some people do. So I don't minimize the stressors that some folks have right now. But at the same time, this is a stressful time. And so for me, practicing gratitude is really important. If you focus on the negative, you propagate that in your thoughts. You foster that, and you give it energy. And so for me in this time, one of the things I did early on, when I would put my son to sleep at night, is, okay, we're going to name 3 things today that we're thankful for. And go through that. And so for me, that became part of my own mental health ritual. And I just wrote an article called PPE for your mental health. So check it out if you have some time, and if that's of interest to you. But really focusing on gratitude is important. Focusing on the positive, having some sort of mindfulness practice. So for some it's prayer, for some it's mindfulness, for some it's just walking out in nature, but having something that you do that helps you center, helps you pay attention. I think the biggest thing that you can do for your own, one of the biggest things you can do for your own mental health is be mindful, pay attention. I remember my first year of med school, one of my friends, we had a physical medicine class where we had to evaluate each other's spines and all of that kind of stuff. And I'm in this class, and one of my friends is like, "Hey, Joe, lower your shoulders." And I'm like, "What are you talking about?" I'm like, "Lower your shoulders." Like, I was so clueless that I was stressed out, that I was basically wearing my shoulders for earrings. I had no idea that I was carrying stress in my shoulders. And so part of that mindfulness, I think for me personally, every night, I will typically do a head to toe scan of just a check-in with myself. How am I doing? Is there any tension or stress? Am I feeling anything in my body? What's going on? And so I think, part of that mental health plan for me is a check-in and being mindful and being aware and not wearing my shoulders for earrings and not realizing it. It's like, what are the things that we walk around with? There was a point where I was grinding my teeth. I was having jaw pain in school, and I didn't realize I was stressed out. And so I wasn't doing this anymore, but I was doing this. And so it's like, okay, relax your face muscles. Your face is tight. And so as I go to sleep at night, I'm like, okay, am I carrying tension anywhere? Is it in my shoulders? Is it in my mouth? Is it in my stomach? Where am I carrying that tension and that awareness? And having that personal time to check in. And it doesn't have to be long. It can be 30 seconds, it can be a minute or 2. It doesn't really need to be this whole long, big, drawn out thing. But having your own mental health, because, we hear about burnout. We hear about all of the things that physicians are dealing with. Physician suicide, is a big deal. It's a real thing. And so having ways that you know how to deal with your own stressors is going to be really important to make sure that you don't get burnt out, whatever path it is you take. That is super important to understand. So for some people, it's journaling. For me, my some people started sourdough bread during COVID. For me, I picked up the piano again and I started playing. And I was like, okay, instead of picking up my cell phone and scrolling through Facebook or whatever, I'm going to go and sit at the piano for a couple minutes and play. And so whatever it is, have an outlet, have something that you do that fills you up.
Thank you for that. What has been the most difficult patient case that you have treated? If you can talk about it a little bit.
I had an atypical appendicitis once that came in, and it was one of those where I walked through over and over again, and I talked to people afterwards, but he presented totally atypically, and I sent him off to the ER, but I wasn't 100% sure where it was going. And he was one of those folks, he didn't have medical insurance. He didn't want to go to the hospital. And my gut was just saying, this guy needs to go in. Something doesn't smell right. And it taught me to trust that gut feeling that you have. But it was challenging because, it bumped into the medical system and, not having insurance and that being part of the factor. Like, this guy was walking around, his appendix had actually already ruptured, which was why he was presenting atypically. And he was taking, which he didn't report to me right away, he was taking his girlfriend's opiates that was masking the pain and was masking part of the presentation. So it was challenging for me because he basically was walking around with a busted appendix in my office. It was one of those things where he did delay getting in for a bit. And then when he did go in, the appendix had ruptured and it had actually migrated toward his spine and walled off. So when the surgeons went in, they're like, what the hell? They opened him up, and they had actually opened him up wider because his appendix had ruptured, had migrated all the way to the back of his spine, had encased itself, had kind of re-encapsulated. It was just the craziest, weirdest thing that was totally not textbook. Like, it was just something, I talked to doctors afterwards and they're like, I've never in my 20 years of practice seen something like this. So there are going to be things that are going to stump even seasoned folks. And, there, not everything is most stuff's going to be textbook, but every once in a while you're going to have a unicorn. That was my unicorn.
Thank you so much for answering all those questions. At this point, I'm going to ask, do you have any last minute advice or anything you would like to say to the pre-health students here?
Yeah, well, gosh, thank you. Follow your path, follow your own truth. Don't let folks get you off track on that. Write down your why and seek out mentors where you can. And remember, at the end of the day, it's about the patient. So, when you're questioning, when you're thinking, remember, this should always be about the patient. So with that, I bid you all thank you.
Thank you so much, Dr. JoAnn Yanez. It was a pleasure to host you here today on Pre-Health Shadowing.